Okay, so this video is going to be thinking about the scalene muscles and the SCM muscles. So scalenes are more below your collarbone, but they do have some fascial connections, some soft tissue connective tissue to the collarbone, and they run up into the cervical spine, the neck, okay? But then more towards the front here, towards your sternum and the inside of the collarbone there, the SC joint, you have two attachments here that converge to a single attachment here behind the ear. That is the SCM muscle. That's a rather large muscle and can be very problematic, especially when you're tight on both of them. It tends to pronounce like a forward head because it pulls that mastoid process behind the ear towards here, so your chin typically will jet out more. So if it's difficult to bring your head on top of your shoulders and tuck your chin, odds are that's pretty tight. But we can isolate those out with different positions and stretches, but we're thinking about posture here. So I'm gonna take my hands, I'm just gonna pin down the tissues on and around the collarbone, more towards the inside, but maybe about a third of the way out. So using all the fingers if I can, and just kind of pin that all down. So that way, as I hold myself up tall, I can open up that canopy up there, keep those shoulders out of the ears and the head up tall and the neck up and chin tucked. Now, as I look up and away, I can imagine that stretching more of the scalenes here, and I can take a deep breath in and exhale and try to focus on letting that go. I can use a physiological size. Speaking of that quick inhale, that sniffle, if you put your fingers up a little higher, like above the collarbone, and kind of feel there. If I do that, you'll see those, and you'll feel those for sure. You'll feel those pop out, those scalenes. There's 3 of them. We're really mostly concerned with the first 2, the anterior and the middle, because those ones directly attach to the first rib, which can elevate that. Okay, so we want to just make sure. And focus on the release on the exhale. Now, if I'm looking at that same side, I can actually, I'm side bending my head. Okay, so I'm pulling my head away from to the opposite side, and I can turn my head now that way, and that's going to get more of wrapping around that SCM. Stretch there. Again, I'm thinking about posture. I'm kind of getting a stretch, trying to open that up, and then maybe I'll check my other side over this way, looking that way, or up and away. Now I'm stretching the scalenes